Welcome to the Surgery Pro Podcast, or as we like to call it, Procast. My name is Marissa Melby, and I'm going to be your host today. We are excited to say that this is our first episode of many to come. For those of you who don't know, we are a healthcare company in Guilford, Connecticut that focuses mainly on orthopedics and OBGYN. Today, Procasters Barb Doyle and I are here to talk about women and bone health. Hi, Barb.
Hi, Marissa.
I'm not sure our listeners know this, but if you are under the age of 50, you may be at risk for bone loss.
That's very true. Even women in their 20s are now experiencing bone loss at a higher rate than they have in the past. Most of them don't even know they have bone loss until they have a fracture from a minor incident like stumbling or walking into something.
I think this is probably because most doctors recommend bone density scans if you are 65 and older, and there are no guidelines for younger women. I'm 26, and I can safely say that I have never thought about the risk of bone loss before.
Understandable. So what do you think has changed?
Well, it turns out that escalating rates of bone loss in younger women is partly due to trends, such as over-exercising and not getting enough vitamin D and calcium. If you over-exercise, you could risk dropping your estrogen levels, and estrogen is needed to build bone density. As for vitamin D, you can't get it from a multivitamin. The sun still remains the best way to absorb the right amount. Unfortunately, we all know the problems with the dangerous rays of the sun, and sunscreen with an SPF of 30 blocks almost all vitamin D from being absorbed.
Wow, with all that being said, what do we do to get the proper amount of vitamin D then?
It turns out that getting about 10 to 15 minutes of unprotected sun daily will help with vitamin D absorption without risking sun damage. And for all of you faker bakers out there, most tanning beds do not emit vitamin D producing rays, so don't use it as an excuse.
That's for sure, so stay out of those tanning beds. Well, genetics are also at play when it comes to bone loss in younger women. If you're a small-framed, skinny Caucasian woman, you're definitely at more risk than others. So if this is you, make sure you talk to your doctor about getting a bone density scan. If you're experiencing bone loss, you can certainly take steps to prevent further damage or fractures. As for women over 50, we all know the story of Academy Award winner Sally Field, who was diagnosed with osteoporosis around the age of 60.
Yeah, Sally became the spokeswoman for the nation with her commercials about bone loss medications and how osteoporosis has affected her life. After watching the commercials, many women probably asked themselves if they could be at risk.
I bet they did. It was pretty powerful to watch that. So a major cause in bone loss for people over 50 also turns out to be menopause. Estrogen levels drop during menopause, causing bone loss to speed up. Many doctors will prescribe hormone replacement therapy to help stop this.
So what else can women over 50 do to prevent bone loss or at least slow it down?
Well, exercise is primary, such as jogging, stair climbing, using the elliptical machine. These are all great ways to build bone and muscle strength. When you do these exercises, you're forcing your bones and your muscles to work against each other, and that makes them stronger. Exercising also increases balance and strength, and that makes you less likely to fall and have a break in the first place.
So why is it so serious for women over 50 to have a break or a fall? We've all broken a bone once or twice in our life, but I guess after 50 there's much more risk involved, even with the smallest fracture.
Well, that's very true, and as we age, it does get more difficult. A common break in women over 50 is the hip. More than 350,000 Americans suffer a hip fracture each year, and the rate of hip fractures doubles every 5 to 6 years after the age of 60. When you think about that, that is a huge factor.
Yeah.
As you can imagine, healing fully from a hip fracture is very difficult, and it can often require long-term care. It totally strips you of your independence.
Yeah.
Some women never even regain the ability to ambulate outside the home, or even at all.
Yeah, that's pretty bad, but I think an even scarier statistic is that once over 60, mortality rate can increase up to 36% in the year following a hip fracture.
Wow.
Conditions like deep vein thrombosis, pulmonary embolism, pneumonia, and of course complications from surgery are some of the causes of death among hip fracture patients, so it's pretty serious.
It certainly is. 36% death rate is absolutely staggering in a year following hip fracture. That's just amazing.
Yeah.
Well, bone density and osteoporosis are very serious conditions that all women can be affected by. If you're worried and that you may be at risk, make sure you talk to your doctor about getting a bone scan and take steps to prevent bone loss. There certainly are things you can do.
Yeah, of course, please visit surgerypro.com for more info on all of this and all the articles used for this podcast. And don't forget to like us on Facebook at facebook.com/surgerypro. And make sure you stay tuned for our next episode where we talk about surgery after a break or fracture.